NAMI does one for family members. I forget what it's called, but we have it here in the past. It's a special one for family members.
They have family, right?
It's a, NAMI does a training for family. No, it's a story,
Yes, ma'am.
just like you guys stick it out. We had it here a few years ago.
I was a part of that in,
Did you see, who was that with? Jacob? Was it Jacob in it?
Yeah.
Cause I was on the radio too now. It's been a busy,
Yes.
it's been busier.
You told me yesterday. That's awesome.
Hey, are we gonna do this tomorrow Zoom meeting?
Maybe you read one. Do
Well,
you want to do Zoom or just come to my office? So Eric, are you gonna be in town? I know.
Okay, my, call with Regina, California ends at, 10:15.
Oh, so you're gonna do that from home?
Yeah. It's a Zoom.
Okay.
So then I could.
Thanks so much.
We don't
But
have
at
to
least-
be.
that's fine. Yeah, it doesn't need to be on the dot. I just want to go through the grant together, so.
Okay, I'll come to your office, I have to go down there anyway.
Yeah, that's what I
Before
thought.
meeting, so yeah, okay, I just, the travel time would. Takes me.
Yeah, whenever we get there, it's fine. Now that you know which building you're gonna see, you can just let yourself. I'll be there waiting for
Oh, I know where you are now. I don't go up the steps and I go on the cement.
Yeah, I just think it'll be easier to work on the grant.
Oh, yeah, that's what I thought. And then I got the thing and I thought, I wonder if really wanted to do a Zoom thing. That's amazing.
I just put it in the calendar so I would remember.
Okay, got it.
So it'd be on my schedule. They live it down. Okay. Yeah, that was.
And you gotta act serious now.
All right, welcome everyone. It is 12:15. You are at the Behavioral Health Board monthly meeting. We are the advisory board for the Board of Supervisors. We hold this meeting on the fourth Thursday of each month and it runs from 12:15 to 2:15. We meet here in person at 507 F Street in Eureka. This is a public meeting and everyone is invited to attend. Members of the public may participate remotely. The minutes and the agenda can be found by searching online for Humboldt County Behavioral Health Board. We provide time for public comments early on in the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to the Behavioral Health Board. We ask you make your comment in a respectful manner. Please note this meeting is being recorded. And if you have any questions, contact any Behavioral Health Board members. And with that, I will ask for Joe to take the roll.
John Berger here. Marguerite Story Baker.
She's here.
Yeah.
I'm sorry, my, my ears are plugged up
Okay,
and so I can't hear well.
Bob Story. Here. Raphael DiCaprio. Here. Lauren Montana.
here.
Natalie Arroyo. Bassett. Kelly Johnson.
Here.
Matt Cattleman. Vern Price.
Here.
Peter Stoltz, Steve Alex Childers.
Here. And we have a quorum. All right, so now we'll go to introduction of staff and guests, and we will just go around the room. Vernon, you're just there and start with on that side of the room, so.
Oh,
That would be you, Leah.
oh, okay. I'm Leah Nagy. I'm a family liaison with Humboldt County Mental Health. I also mentor in parent partners, and I'm also currently the president of NAMI Humboldt. And I'm glad to be here. I'm gonna make a meeting.
Thanks. Eric, do you want to introduce yourself?
Sure, I'm Rick Thompson, I'm a concerned citizen. I was on the board for 10 years a while ago. It's good to see everybody coming in. I think we're doing a lot of good work. I noticed this, doing Vern's doing, It looks great. It's a wonderful flyer. I love it. Brave training. Goodness, I think we all need to become a little bit more brave when we're trying to help our fellow citizens.
Thank you.
Johnson, I'm an analyst who works with DHHS administration.
I'm Michael Petrelli, I'm a behavioral health fiscal analyst.
I'm Rhonda Oath, I'm a peer three at the Sun. Oh, I'm two. I'm over here. Introduce yourself.
I'm Brenda Montaigne. I'm a health center participant.
We will go online, and if you can just popcorn to each other. Starting with Nancy.
Hi, I'm Nancy Stark. I'm the Legislative and Policy Manager for the County Health and Human Services. I'm going to popcorn to our guest, Connie Stewart.
You're muted.
Hi, I'm Connie Stewart. I'm the Executive Director of Initiatives for Cal Poly Humboldt, and I am working with Nancy and DHHS and Mad River Hospital to build a behavioral health triage center. Happy to be here.
She can popcorn it to Oliver.
Good afternoon, everybody. I'm Oliver Gonzalez. I'm a program manager at Behavioral Health, and I oversee the Mental Health Services Act. Good seeing everybody. I'll popcorn over to Sonia.
Hello, everyone. Sonia Levy Boyd, she, her. I supervise the Humboldt County Transition Age Youth Collaboration and the peer coaches at the K Division. And I'll pop over to Kelsey.
Hello, everyone. Kelsey Reedy, they, them pronouns, youth organizer with the Humboldt County Transition Age Youth Collaboration, and I'll pass it over to Joe.
Hello, Joe, they, them. I'm a member of the Youth Advocacy Board with HD Tasty, and I have been for about a year. And I'll popcorn over to Gabriel.
Hello, Gabriel, he, him. I'm a Youth Advocacy Board member and JJDPC Commissioner. Is there anyone left to popcorn to?
I think it's Dana. Would you like to introduce yourself?
Hello, my name is Dana Holcomb, and currently I work at the Humboldt County Correctional Facility with the Medication Assisted Treatment Program, and I'm happy to be here. Thank you for allowing me to be here.
And then we didn't go down the side.
Maybe Kelsey, I'll popcorn to Kelsey.
Oh, thanks, Dana. I think she did
I
introduce.
feel like everyone has already online has introduced themselves.
So we're back in the room.
Yeah, hi, good afternoon. Amy Boxler Rogers. I'm the Behavioral Health Director. Nice to see everyone.
I am Jack Brazil. I am the Deputy Director for Behavioral Health. I'm Paul Vignacchi. I'm one of the deputies.
I think that's everyone here. Unless you want to introduce yourself, Laura.
Laura Coulter, Administrative Secretary for Jack Brazil.
Thanks. I could not hear you, Kelly Johnson. Are there any adjustments to the agenda? Hearing none, we will move to public comments. Does anyone have a public comment in the room? Leah Nagy.
Of course, I always do. So I just wanted the Mental Health Board to kind of know what I've been up to. So Jacob Rosen and I were on Keep TV with James Fall on Headline Humboldt or Humboldt Headlines, anyway, to talk about, we mentioned the CIT training that was last week and also the upcoming Mayor's Initiative on Sunday, May 4th from 11 to 4 at the Warfinger Building. It'll be exciting. It's free. There's a professional panel and then a lived experience panel. And then a speaker named Joe Roberts, who wrote a book called Broken Like Me. And it's going to be exciting. Let's see, the Family Advisory Board that I head up once a month is active, and we have been working on brochures. We've made a total of 3. The third one is called we call it the jail brochure because navigating the jail system is very complicated and families need all the support they can get. Oh, and I was kind of excited because I'm gonna present Families in Focus, which I did in Reading for Toronto University. And I was accepted to be presented at the International CIT training in Anaheim in August. And I'm gonna get my cohort Kelly Johnson, and hopefully Chief Greater Work to join me in that. It's bringing focus to the importance of families and communication with families. Yeah, and the only other thing, Gretchen and I are gonna start a group for folks in the community who have mental health challenges, who aren't part of DHHS or mental health or anything. They can just come in like my family support groups and get support. And we'll start that at Uplift probably sooner rather than later, and you'll be seeing flyers for that. I'll try and get flyers to Joe that the Family Advisory Board has developed so far. One's Families in Crisis, one is just Family Resources, and then the jail one. So anyway, thanks, guys.
Thank you.
Hey, I'm Rhonda. I'm a peer 302 at the Hope Center. And I wanted to come just to announce that everyone that our May calendar is out with all of the community events. There's lots of fun stuff going on. If you have any questions, please call the Hope Center.
Hi, last month I came in, told you guys I was gonna show up every month for a year and tell you about my experience of being a mental health patient here in Humboldt. Last month I told you that, at the tail end of perimenopause, I was pretty much abandoned by my primary and, nobody would help me. That led to an incident where I was taken to St. Joe's, where they decided putting me in 4-point hard behavioral mechanical restraints was a good idea. Restraints cause severe injury and death. And this is well practiced at St. Joe's. They are quite good at it. They get 9 nurses all ready at the ambulance door and with the restraints and a gurney, and they do a very unprofessional transfer of you. I landed on my right side on the gurney. Later, they decided to put me in a self-adjusting hospital bed, same kind of unprofessional transfer. I landed on my right side again, and my right tortienter and the right side of my body was very severely injured. Last Thursday, I was coughing and I broke a rib, and I ended up back at St. Joe's, and what a great experience it was. They fixed me up and I was there at 1 o'clock. I was out of there by 5. My rib is mending great, and I was just really impressed with the doctor and the staff. I did hear a group of nurses gossiping at the nurse's desk about how they had a girl in restraints in there last night and she got out of them and then she just sat on her bed and stared at the wall. Probably nobody went in there and talked to her. I was in there for 30 hours. Most of the time, I was all by myself in seclusion, in restraints. The one person who did get me out of them was a student nurse named Amy. I am looking for her. And the nurses kept on saying, can't you take you out of those without doctor's orders? And he's really busy with people who are actually sick. So they decided, besides putting the restraints on, that they would forge the restraint orders and records. And I have brought these in for you to have a little fun with forgery on YouTube. And it'd be nice if you took a look at those for me. I want to thank Assemblyman Brown for writing and passing this Brown Act so I can make this comment every month. All right, you guys have a great meeting.
Thank you.
Thank you.
Is it all done for public comments?
No, we're not done. Do you have a comment?
Yeah, I have a public comment. I understand through Leah that there's a couple groups that are doing mobile outreach programs for the homeless in Eureka. And to me, that mental health is probably the best organization suited for doing outreach programs because they offer medication management. And the outreach programs that are existing tend to be kind of buddy systems that kind of go around the homeless person and find out that they probably don't want to be there, but they have no other place to go and that cut around the options. But, the mental health could take action in really helping the homeless people to take medication. And, I really do think through my experience with mental health, the medications are really a good answer to mental health crises and whatnot that we're going through. So I'm hoping that we can really have a discussion about how mental health can possibly work in conjunction with these two other programs to get the homeless off the streets and get them in a healthy place. That's it.
Thank you. Else in the room? Moving to online to Zoom, is there any public comments? All right. Hearing none, we will move on to action items. And everyone's read the minutes from the 327 meeting. Does anyone want to make a motion?
I'll second that motion.
All right. All in favor of approving those minutes, say aye.
Aye.
Opposed? Stand aside. All right, those minutes are approved. And with that, it is time, the moment you've all been waiting for. Behavioral Health Crisis Triage Center presentation. I'm not sure who's starting. Connie, are you starting, or Nancy?
Or Emmy, do you want to start? we didn't pre-rehearse I'm happy to start, but I did want to know if Emmy wanted to set the stage.
Well, I didn't prepare anything to set the stage, but I will just underline what you said, Connie, which is this is a pretty incredible partnership between you and County Behavioral Health and Mad River Community Hospital, and St. Joe's is Providence is supporting as well as others. So I feel pretty excited, and I'm glad you're going to share the details with this group. So thank you for that.
Oh, wonderful. So and thank you for having me at this event, and I mean at this meeting, and I'm happy, let me just say I'm happy to come back anytime and give you updates on what's happening with this amazing project. Many of you might remember, and actually our last speaker kind of talked about, ending up at the emergency room with acute challenges and being strapped to a gurney and having other issues happen. So the community, the hospitals were concerned and wondering, like, how do we, I apologize for my language, but this is what people were saying. How do we get people out of the emergency room? And a group of us, including the county, realized that was the wrong question to ask. The right question was, how do we address families in crisis who are having acute care crises and treat them with dignity? And once we asked that question, the answer became clear that we needed to create a center where people could be triaged and treated with respect and treated. Nancy, you want to turn to the next slide? So the response to that was everyone leaned in. Mad River Hospital stepped up to the plate and agreed to provide land for the creation of the Behavioral Health Crisis Triage Center. The county agreed to put up $2.6 million in match money, and we went after a state grant from the Behavioral Health Continuum. Nancy, help me out.
Behavioral Health Continuum Infrastructure Program.
Thank you. I knew I was missing my eye there. So BHCIP And we were able to get about $12.4 million from them. And then Providence St. Joe has agreed to help with a $2 million donation. And then we have a private foundation that has given us $2.5 million. And Senator McGuire has also helped by giving us some money in the budget. And so he's given us $500,000. And very soon there'll be some advocacy work to do because the city of Arcata is considering writing a grant on our behalf. And that will be coming up in the next couple of months. A group of us went down to Orange County to see a project called Be Well. And Be Well is a single building that has a triage center in it. And we all were very excited about what we saw there, and put together this partnership. Currently the plan for the building is about 2,100 square feet. And it will serve children, youth, adults, and provide a calm place for confidentiality, compassion, and that will treat people and all individuals with dignity. It will also be an amazing place for workforce. And we're hoping it will be a soothing place for people who are working, helping those of us who are having crises in our community. So, Nancy, I think that's enough for this slide, unless I'm missing anything. Let's go to the next slide. The goal of this facility is that families in crisis will receive prompt care. The space is designed to provide space for both substance use disorder issues and mental health mental health recovery. It's also designed for both we'll have residential spaces in there, as well as a crisis stabilization unit and a sobering center. So the idea will be that there will be multiple ways of seeking treatment. And then our goal will be to work with clients to make sure that they are transitioned seamlessly to outpatient care, so that there's not a cycle of them not getting support on their journeys. Here are some of our guiding principles. As I've said repeatedly and can't say enough, a safe, confidential healing place for both youth and adults. A place where workforce can have a team-based approach with our clients, a place that's connected to nature. And I'll just pause and tell you this story. When the foundation came up to determine whether they were going to support the project or not, and we walked them on site, it was unbelievable. A rainbow appeared right on the site. So when I say connection to nature, it was just incredible to have this rainbow appear right as the foundation was visiting, and the foundation was like, that's a sign we need to give money to this project. We will be able to also treat people, with cultural humility. The site is located directly next to United Indian Health Services. It will be designed as a client-centered place. It will have a continuity of care, including a sobering center, a crisis stabilization, and residential care, and then that connection to outpatient, which we know is so critical. So, have I covered everything on this? Yeah, let's go to the next slide. We'll get you closer to pictures. I think I've even covered all of this, but let's go into a little bit of detail. So we'll have 8 crisis stabilization beds for adults, or chairs, I should say, for folks. And we'll have 4 crisis stabilization for children and youth, 10 recliners for the sobering center, and 19 crisis residential beds for crisis residential and for dual diagnosis there. Yes, yes, absolutely. These slides will be sent out. And Kelsey, if you would like me to do a presentation in front of HC Tacey, I would love to. I really, HC Tacey had a meeting with us before we applied for the grant, and I can't tell you how valuable that input was to the design and our thoughts around this building. You can skip this slide. I think you all know where Mad River Hospital is. So let's go to the next slide. So if you are familiar with with Mad River Hospital, this building will be placed in the corner of the place, away from the residents across the street and right next to the horses in the next who are on the next property over the fence. So and then now I'm like, why did we leave the slide? Just site circulation. We just want you to know we're thoughtfully considering how pedestrians can get to this corner and how people can drive directly to this corner of the facility. So we will be doing some rerouting so that folks can find the facility and also safely get there, whether they're walking, biking, or whatever mode of transportation they're taking to the site. There is also bus stops right outside in front of the site as well. So the site is being designed to take inpatient. So you or your family member can bring you into the site, or we unfortunately, if someone has to bring you there as well, there'll be the ability to do that. And I'll show you one of the things I'm most proud of soon about this site. So here's a little bit more about how we considered the site. And actually, we have a wonderful architect. We hired the same architect that that designed the B. Wells building that we went to in Orange County. And she came to us immediately when we thought we could put the building a certain direction. And she was like, no, because the views, I need to consider the views of this building. And so she asked Mad River to agree to move some facilities in order to be able to best site this building. And to Mad River's credit, they're willing to move those buildings and provide this ideal space for us. So next slide. Here's some detail, and I will, as I said, I will send you the slides so you can study this in more detail. There are a couple of little minor errors, so consider this a draft slide deck, but I think it's close enough to be able to share it with folks. But it'll show you under this all of the space allocation. As you can see, there's a lot of residential space compared to some of the other spaces. We've made those residential areas very, very very thoughtfully designed them so there's living rooms and other areas so it's not just like you're in your room, right? You can come out and socialize if you want to, or you can go into your room if you want to. So it's sort of like an apartment almost. The residential areas there. It was when we went down to Be Well, it was something that struck us all how much dignity was put into the residential spaces. So next, here are all, as I mentioned, we really worked with the architect about like, how should we design this building? So on the left side are some of all of the different kooky arrangements we made before we all said, you know what, let's just make this building so the residential side has its own wing, and then you sort of progress through the building. Next slide. Unless Nancy, you want to say anything else about that or that, we'll get to the pictures of the actual building, which we're starting to give you a little hint. And this is like what potentially the building could look like. It will have its own parking spaces on the Mad River complex, and this is our dream with solar panels and everything, so it can be a green building. Next slide. And here's and like I said, I apologize because I know that these pictures are smaller, but here is the thought that went into the floor plan. And when you get the slides and actually can go through them, you'll see that, you know, we have a lot of confidential spaces put throughout the building, a lot of places where you can go in and have one-on-one meetings with staffers. You know, there's public spaces too. So if your family wants to come in and they will be treated with dignity too while a client is being helped as well. There's spaces for their families too as well. So and there's showers and laundry rooms and other facilities built in, little kitchenettes and all sorts of places. There's also and you'll see it in the next picture really well, this bay on the left-hand side, and that's for privacy. And Nancy, why don't you go to the next picture so we can show kind of
On this slide, if you'll excuse me,
go ahead.
on this slide,
Go do more.
I just wanted to point out that there was a lot of thought given to having a separate CSU, crisis stabilization unit, for children and adolescents. And really, what does that look like for the child or youth and the family members who might bring a child or youth to the crisis stabilization unit? And really, what does that look like from a regulatory perspective of really having that separate space? So that's the point. That's the one thing I wanted to point out here. We'll move on to the next slide.
Oh, well, I was going to say, since you said that, let's pause for a second. And I mean, we spent months on this, all this stuff, so I shouldn't just brush over it. You know, each of the crisis stabilization areas has an outside space as well. So clients, while they're sitting down, they can also, you know, go to the outside. There will be lockers for people to put their spaces. We recognize people may show up with shopping carts, so we've thought about where people can park shopping carts while they're seeking aid too. And so you know, and then we also design staff lounges for, you know, so staff can get some respite too if they need to have a moment or that. So anyway, we're very excited about you know, having this patient area, residential area, and outdoor area all in one building. So let's go to the next slide.
I'm trying. It's not advancing very well.
It's okay because it wouldn't have been working for me either. So I'm glad to see someone else suffering with the next slide issue here. So
okay. One second, I'm trying.
And if you don't, I can try to take over too. Yeah, I can do it if you want me to. Okay. Oh, request sent. Okay. share screen.
Sorry, it's just not advancing for some reason.
Okay, I am going to this screen and I'm hitting share. And I am then making this bigger and I am going to present mode. Oop. And now I have to go toggle up. Okay, not that far up. So hold on. Technology issues. Here we are. We're going to get there. Didn't realize I was going to end up having to go back to the beginning, but we're getting there.
Nice summary.
Okay, this slide was worth the wait. Here's our inspiration board for what our architects were looking at. So as you can see, they were thinking about materials that are in nature up here, thinking about windows and light a lot, and the fact that we were near water. So this was their inspiration for designing. And this is just a draft rendering. And believe me, there's going to be a lot of opportunities to help in the next phase, but this is just the initial. Here's what we want to start showing the community so that they can comment and reflect. So I'm gonna start with the bays. Like, unfortunately, we can't afford two. So one is going to disappear, but the idea is to have a bay where if let's say you're in crisis and you're not coming of your own will, like you need to come to the sobering center. The idea was not to have you coming in where everyone can see you, right? So you can come into this bay and be treated with respect and then go directly into the sobering center without if any of you have been in the emergency room lately, kind of this, hi, we're all here and we're all in crisis, attitude. Yeah, like I said, we're interested in treating people with dignity here. So, and if I scroll back to the floor plan, you start with the sobering center, and then you go into the crisis stabilization centers, and then the residential center is on the right side. So that is our thought process. It's kind of a journey through the building. I'm done. Any questions, comments, thoughts, please share.
Start over there. I have a question.
Oh, no, you can go. You can go.
Go ahead. All right, I'll go. When the youth are in the crisis stabilization unit, I'm assuming there's still a 24-hour limit, is that correct? So if they need a longer hospitalization, would they still go out of county for treatment? Paul, do you want to answer that?
Yeah, well, hopefully, we'll get funded for a new SV, and when we have a new SV, we're designing that to have the capability to accept and treat minors on separate virus, so we can treat them locally.
Okay.
But until then, yeah, we would, need to send them out of county for additional higher level of care.
And would it be similar to like how it is now with the emergency departments where they would stay until they find a bed, so they would go over the 24 hours if needed?
Yes.
Okay. Thank you.
We're also looking forward to Sorrel Leaf coming online for the crisis residential for adolescents.
All right, we're gonna go around the table here, Raphael and then Bob.
Yeah, I have a question regarding the sobering stations. Is there going to be MHE services provided there? Is there going to be, are we going to be doing cows and CWAP? Is there going, I just have a lot of questions about the sobering station, which is if there's Because right now, Mad River does not do any MAT, they put people in cabs and send them to us. So I'm just wondering who is going to be heading that component.
I'm waiting for Paul to answer that question, but I will just say that Mad River has provided the land. They will not be running the facility. So that's when we talked about the partnership, the county will ultimately be deciding on services and the service provider in this building.
I can just add, I mean, we'll be contracting out for services, that's the intent of the county role, and so we'll be working with contractors to provide services and talking about what those might look like.
Gotcha, awesome.
Yeah.
Program hasn't been developed yet?
Right, not at all, but just like the skeleton of, these are the types of services members of vets, yeah.
Thank you so much, thank you.
Yeah, and I like I said earlier, don't think this is we want to come often and early to talk to you all, because there's still a lot to design with this, and still a lot of flexibility. And so, you know, what kind of services, what they look like, how they are carried out, there will be seeking a lot of consultation on that. And I'm really glad to see Connie back. Hi, Connie, and hi, Paul.
Well, do we have a projected, I know it's early in all this, but a projected date for opening?
We have told the state that we hope at the end of 2027. We still have more money to raise. So, but we are doing really well, as you heard. We've got almost $21 million. So $20.4 million, I think, as of Nancy's last count. So we're raising money fast. I think we're conservatively 4 million short. So and I think I know where 1 million of the 4 million is coming from. So I'm feeling pretty good about how fast we're raising money, but the goal is the end of 2027. I know that sounds so far away for our need. I know that, but it's pretty fast in building time.
Another question here, Vernon?
Yes, ma'am. Is there any positions available for peer coaches or peer support specialists?
I think, again, Vernon, that will be part of what we determine through the contracting process. So that whoever we're contracting with, they will present how they propose to run the services or the programs there, and that
concern be brought in at that time?
Sure, yeah,
Okay.
yes.
Thank you.
Yeah.
One of the things that I think is important is the programming is such a moving target, because like sobering centers, there wasn't an ability to claim for sobering centers in the past, and now there is. There is a funding mechanism through PALAIM, which we didn't have before. And we haven't even researched what that looks like. What does that look like now for sobering centers throughout the country? We just have no idea. So, we've been scrambling to figure out the building, and I wasn't sure, Connie, did you mention the architect and their experience in?
Yes.
In building these type of buildings, because I think that was really helpful for us. Because we would say, oh, we want these things, and they would say, this is kind of how we've done it in the past. And if we said something that was totally off the wall, they would say, you're really off the wall. They were really good about that, so super helpful.
Yeah, and I talked to Connie a little bit about how how we had to go to Doug and ask him if we could move one of his buildings, or two of his buildings actually, because of the space and the view issues for ideal space. So we're really grateful to have knowledgeable architects on this journey with us. They specialize in building buildings like this.
Yeah, for sure. I'll just add that just to the question about what will programming look like, we'll really look to the experts in the areas. And I want to just flag that Dr. Bayan was part of our initial look at Be Well. And so, you know, we all have so much confidence in her that I think that whoever we end up contracting with will get to bring those innovative ideas, unique approaches to how we do this work.
Let's go to questions online. Kelsey?
I'll go to Joe first. They had their hand up first, and then Dana.
Okay.
Hey, I was wondering a few things. One, do we know if the staff who are going to be at the center are going to be trained in how to address specific minority groups that come to the center?
Well, I was gonna say, I can let Emmy answer that question, but let me also just say at Cal Poly Humboldt, you know, our social work programs and behavioral health programs have cultural humility built into them. So we are increasing, even for nursing, our education pathway in cultural humility. You know, I want you to know that, and I'm going to let Emmy talk to that, but I want you to know Cal Poly is dedicated to trying to teach those skills better as well.
Yeah, I mean, I would say, again, we're contracting out for these services, but our values are how we engage with contractors, right? And so we'll put out RFPs, we'll be engaging with contractors to find somebody who's a good fit, but always conveying our own values around equity, that work, and ensuring that the culture that we're talking about here is being promoted and supported.
Okay, I want to emphasize that there is a very large increase in transgender individuals seeking urgent mental health support because of a lot of the laws and regulations that are currently being passed. And there are a lot of free trainings available that HCTC provides and Clear Humboldt provides. And if possible, I would like that to kind of be something that the staff are trained on, especially with the current political environment. Also, I was wondering if there's anything specifically to try to help ensure that you will be able to staff this program due to the national mental health field staffing shortage.
Let me just say that there is another initiative which we are working on specifically about behavioral health workforce. And we have hired a consultant to help us better understand how many clinicians we're going to need in the future. And also, both Cal Poly Humboldt and College of the Redwoods have been having discussions about health and mental health workforce. And one of the projects, and I'm happy to come talk to you about that project as well, is the healthcare hub. And Cal Poly Humboldt and CR will be creating a healthcare workforce training center in Arcata so we can consolidate and better coordinate healthcare education needs in the region. So there are entire initiatives, and also we have an additional grant, the K-16 grant, to creating health pathways in our high schools to encourage youth to go into healthcare fields. Cal Poly is about to announce dual enrollment opportunities for high school students and to get a jump on college as well. And also we're working on dual enrollment for CR and Cal Poly as well. So I mean, I know I'm here supposed to be talking about the behavioral health thing, but I do want you to understand, we know we have a workforce shortage in our region, and we are also all hands on deck working on that as well.
Awesome. I was just wondering because I know that's a problem a lot of programs are facing currently.
Exactly. And Nancy, maybe we can share that career pathways map with that we just have created that we're working on to better educate youth about their opportunities in healthcare and what the journey and the pathway would be to becoming having a healthcare career.
Okay, I'll pass it back to Kelsey.
Thanks, Joe. I just was going to say there's a lot of details that I think we all have a lot of thoughts about. So I just wanted to know, what is the process going to look like for getting input from community members and young people and everyone?
Kelsey, I am going to, if you don't mind, I have ideas on the process, but more importantly, you have ideas on the process, I'm sure. And really, honestly, we are going to try to take community engagement very seriously. We have time. So, please help me. I mean, I know a few places. I mean, I do know I'm going to call HC Tacey, but you will know other places where I should be doing presentations or we should be having workshops and, where we can put a big plan in front of us and talk about it. I am happy to by Zoom or when I'm in town in person, appear anywhere to talk about this thing. I want as much input from folks as we can get as we move forward.
That's great to hear. Thank you so much. I look forward to getting an email so we can brainstorm on some things.
Absolutely. Thank you so much.
Dana, looks like your hand's raised.
Yes, I have a comment. I just want to say that you have a beautiful, beautiful vision, and I appreciate what you're doing. I'm super, super excited. And I just want to tell you, congratulations on what you're doing. It is absolutely amazing. I'm believing that Raphael and I are going to be right behind you, but I'm so excited for you. And it's a beautiful vision, and you've did incredible work. So I just wanted to say congratulations.
Thank you. Well, first of all, and I just want to, reiterate all of the partnership between the county and Mad River and St. Joe's, $2 million from St. Joe's. So, when you see people, there took a lot of folks to come up with this vision. AC Tacey, like I said, that was a critical meeting we had early on with AC Tacey on designing the building. And every time we come in front of this board, too, you guys have such important things to say. I feel very honored to be a cheerleader for this kind of work in our community. And I get very emotional that I have had the blessing to be trusted to work on these things in the community. So I thank you. I thank you for acknowledging that, but thank you all, because really I feel like I just am your cheerleader. And and that's what I'd like to be able to do for the next few years until we finish this project.
Well, you're very, very humble, and the fact that you have Mad River willing to move buildings it says a lot about what you've been able to accomplish. But
when you if you ever see Doug Shaw or anyone who works at Mad River, you would not believe how kind and generous they have been. I'm just amazed at every day when I talk to him about how committed he is to this building.
Thank you.
Thank you.
Another question.
Oh, so I've got a couple questions. I think Gabriel had a question online earlier, though. I want to make sure Gabriel got a chance to ask.
Gabriel, are you there? Do you have a question?
I think it got answered. I messaged him about it, but I think it got answered already. Thank you.
Okay, great. So my questions, I think I heard you say that the triage center would be 2,100 square feet. On the slide, it said 21,000 square feet.
1,000, sorry. I tend to drop a zero every now and then.
Or add one or two.
Or add one, huh?
Okay, great. And then I was also wanting to clarify, so I heard us talking about having two separate CSUs. So just to clarify, are young people going to be in a CSU, a crisis stabilization unit that is separate from adults at all times?
Yes.
Okay,
Yes,
great.
state law requires that.
Yeah, thanks, man.
I have a question. How would transport by the client be taken care of? Would that be done through the cops, or is there a certain program for getting the clients to the CSU unit?
I think that people can be brought, there are lots of different ways, so
Okay.
it could certainly, they could be brought by law enforcement, they could be brought by family, they could be brought by themselves. I don't know, Paul, do you want to add to that?
Yeah, no, I would agree. So there's multiple ways. I mean, our crisis teams can transport, I mean, law enforcement can transport, but that might not be the best solution. EMS could even transport. So there's lots of options, and we'll definitely, when we're putting these things out to bid, be building those into the request that they're able to provide some kind of transportation.
Well, I found that, transportation is extremely important for somebody in crisis. And, realistically, it'd be great if there was some sort of dollar on it or something that went to.
The mobile crisis teams are active, not 24/7 yet. I don't know why I'm speaking for you, but maybe you can speak to that piece. I know you mentioned the mobile crisis teams, but anybody can call and.
Yep.
Right?
Yeah, and they can transport if it's safe to do so. So if the person's willing to go, they can definitely do that. Mhm.
There is some conversation and we'll have some negotiations, I know, with different cities, depending on where folks are coming from, because discharge back to folks' own community is gonna be really important. So those kind of conversations still need to be happening and worked out before, we open facilities, because I know that those are concerns that were brought up by City of Arcata, of course, right? And if someone's having to come from all the way from Garberville, how do they get back to their home if they're transported by law enforcement or others? So there's a lot of conversation that still needs to be had around the programming piece, and discharge is really important too, right? We want everyone to have a very positive experience.
If it's ever SUD related, I have money in my budget to help with transportation with city cap.
Well, we'll ask.
Yeah, they don't have to be a patient, but if it's SUD related, they need to go to a lockdown clinic, or if they need to come to town and they need to get back to Garberville, or they need to get back to Hoopa, we can certainly, yeah.
That's actually very helpful. Yeah, thank you for sharing that.
But it has to be SUD related.
Yeah, I was gonna say that's helpful. Very helpful.
I got a few more questions. I'm wondering if you can talk a bit about what the intake process might look like. I'm especially curious if people will be able to voluntarily come to the center, if people will be able to self-refer rather than getting a referral through a psychiatrist, for instance.
Yeah, I think the sobering center, there's kind of a flow to this too, so people can go in at any point, they can go into the sobering center. They can go into one of the CSUs or into one of the residential facilities, so they can, they can go into whichever level of care that they might qualify for or need. So I think that, it's really, and each one of those will have their own unique intake process. So of course, the soberings would look really different with an intake compared to the residential. But each of those programs will have protocols around intake. And same with discharge and then the level of care. We know that it's so important to have warm handoff to the next level of care. So there'll be warm handoffs at every opportunity we have to do that. So we'll definitely be working that into the RFPs with each of these providers, whoever they may be, as important elements to consider.
Yeah, so I have a couple, I know, several folks my age who sometimes have difficulty wanting to get, treatment, but not being able to offer. And so I'm curious, if, like, that's something that can do for each of these individual programs to show up and say, okay, I think I need residential treatment or.
Yes, totally, yes.
Cool. I'm also curious, what is the length of stay on the crisis residential side?
Typically, crisis res is 30 days. There are some allowances for over. So we're looking at anywhere from 30 to 90 days in any of the residential sites.
And then the last question for now is, so I've been at facilities where, as we heard earlier today, restraints were used or where sedatives such as Haldol were used. I'm curious if, those are things that will be practiced in any of the programs at the center.
Yeah, that, I'm not sure about that level of detail at this point. I can't answer that for sure. I mean, these levels of care are very different than sempervirens. So a sempervirens is very acute, so I would classify these as subacute crisis. I mean, they could be needing acute care. And they could certainly transfer from the triage center to sempervirens.
Thank you. Are there any other questions? Certainly seems to me like this group might want to consider doing a ad hoc recommendations or research. This is early, mid 25 and end of 27, so we have some time, but it seems like we might consider doing that. If anybody is interested in doing that.
I have one more question. Is there gonna be room for peer advocacy?
I think it's too early. It seems like definitely that would be something that would be recommended. Is that what you were asking?
That's what I was asking.
Yeah.
Oh, yeah.
I would say that there is a real push throughout the state around an emphasis around having peers as an integral part of mental health, behavioral health systems.
Right.
So I would be surprised if there wasn't some element of peer support or peer coach level of positions and involvement in each of these programs.
But it has to be a assigned employment position.
I mean, maybe not. I mean, we have volunteers come up and provide some services on sempervirens.
Oh, really?
So,
Oh, that's great.
so I imagine that that's an option, but that would be a program by program decision.
Yeah.
I guess if you think of questions or that you have, would it be okay to email those to Joe and then those could maybe be forwarded to you, Connie, or? Yeah.
I would recommend that that they go to Joe first and then to the county first to make sure they're not there. I can only answer questions about the building and the money. All of the other questions about programming need to go to the county. So that would just be my thing, would be, why don't you internally ask them first, and then if you need to come to me, I'll answer.
And just a reminder that none of the program questions have been
decided. Yeah.
Yes. I have a thought, if we can maybe add it to number 10 as an unfinished business item, so we can get updates each month. Or have opportunity to ask questions, would that be all right with folks?
Yep, that sounds great. All right, Well, thank you so much. Connie Stewart and Nancy.
Thank you. Thanks for having me. Appreciate all of your hard work, you guys. Thank you.
Connie, before you go, I would just like to say, I just want to acknowledge you and the work that you've done in this process, because I don't believe that we would be here without you being there to pull us all together and to work on the collaboration between all of the entities. I know we wouldn't have the amount of money that we have currently because of all of the work that you did there, but I was just sitting here thinking about you keeping us on task when we were down at Be Well visiting the center, and the work that you required us to do. You would make us stay focused for hours putting together all of the things so that we could write the application. So really great job to you and Nancy and Paul. I know that there's just been a ton of work that's gone into this, and I just appreciate it so much.
Well, and thank you to you, Connie, and also thank the Board of Supervisors. I mean, they voted unanimously to allow us to move forward on this project. And put up to, I mean, the budget wasn't that much better than it was now when they found the matching money and cash. And I honestly think if they hadn't come up with that match in cash, we would have not gotten the grant, because so many people who tried to do an in-kind match did not get it. So, you know, I if you see the board, they were just wonderful too. And your CAO too. So everybody's helped. Thank you all. Take care. I know you have a busy agenda. Take care.
Exciting. Communications. This is the time when the behavioral health board members can.
What about number 7?
Oh gee, I actually inadvertently, thanks, Kelly. Why don't you? So we're gonna be electing officers in May. Was that like a Freudian slip or something? Probably. And so this would be the time that we make nominations, or if anybody would like to nominate themselves, that's okay.
What are the officer positions?
So the officer positions are chair, what I am right now, first vice chair and second vice chair. At this time, Sean Berger has said that he would accept a nomination for second vice chair. Kelly Johnson has said she would accept a nomination for vice chair. And I said I would accept the nomination to stay as chair. Woohoo. Right next.
I will,
every time. So is there anybody that wants to make another nomination or say, no, we don't want Laura anymore? Or anything like
I
that?
have a question. So
Yes.
your term's not over yet, right? No.
Go ahead.
Gotcha, okay.
I nominate to keep you as chair.
I nominate you to be second vice and you to be second vice and you to be first.
I'm not sure if that's how that works.
So you gotta help me, Joe, because we never didn't do elections before. You know?
Someone else from, you have to email, so. Have someone from the board.
So I'm nominating Laura to remain in the chair position.
Okay.
And I'm nominating Sean to be second vice chair.
I nominate you.
Yes.
I'm nominating Kelly to be the first vice chair.
And when do we?
Somebody's got a second.
Okay.
Oh, no, I know.
Are there any other open positions within Is there anyone else that wants to put in for one of those positions?
So those are the only two, just for clarification, those are the only two positions that are up for nomination is the chair and vice chair, correct?
Chair, vice, and second.
And second vice, gotcha, okay.
And any board member can nominate any other board member. Correct? Sorry.
I nominate Laura to stay in her position. And Kelly to be first vice, Sean second.
Okay, so we have the nominations and you'll do the seconds for all those? Cool, all right, so we will vote in May.
Okay,
Oh, you don't vote this time? Okay.
it's just discussion at this point.
So did you want a campaign?
Bring a sign, Kelly, bring a sign.
To bring posters? All right, I think that's all we need, right? Thanks, Joe. Now it's time for communications. We're gonna start on that side, and I need to use the restroom, so Kelly, will you, in practicing for your second vice chair?
Yes, I do have communications. We're going to be doing cabling this year. I do have materials from last year. Would anyone have, county staff, have anything new to add this year to these brochures or flyers? I have DHHS crisis services, crisis continuum of care, behavioral health general information, concerns and grievances, and behavioral health program contact information, and adult outpatient, adult systems of care.
Do you have the QR code?
I do not, but I guess I do.
Oh, you do. Yeah.
So if they update the forms, they'll be
They'll
updated on
be
our
up-
website.
Okay, never mind. Thank you.
And here, show me the form. Please, you see, they'll put a date. So when you look on the website, you can see if this is the most current one or not.
Okay. All right, I just want to have all the information to give to the community.
That's great, thank you.
Thank you.
Would you like me to have Jamie or Laurel take a look at all of what you have there and provide an updated?
Laura
version?
Johnson was kind enough to give me the information of last year.
Yeah,
And that would be nice this year if,
she could look through all of what you
That'd be great.
have been provided and then we can go from there. She just walked out of the room, so I've given her a job while she's gone.
I thought you were talking about Laura Johnson.
Yes,
Laurel.
yes, Laurel.
She was in here.
She was here and
Okay.
she also
just walked out. They both did.
Yeah.
Oh.
I wasn't
Oh,
noticing,
yeah.
I'm sorry.
Yeah, no, that's really good. But
Um,
yes, she can help you
Okay,
make sure you got all the documents there.
sounds great. Becoming Brave has been finalized. That will be, we have brochures out, flyers out on the table. That was also sent out graciously by Joe McManus, our secretary. That will be May 31st and 1st. That is a Saturday and Sunday. There is 15 spots. 13 spots available, but that does not include dignitaries. That would mean, Director Beck, Director Rogers, any of the deputy directors are more than welcome to be there. There's spaces there available, or spots available for them also. So I believe that's it. Thank you.
Great work, Vernon, on getting that Becoming Brave training. I'm planning to participate. I'm really excited about it.
Yes, this is a long time coming, so I'm very thankful for this. I'm thankful for Arcata House Partnership of standing against stigma, working together, collaborating out of county. And I'm just thankful that he's able to come up from Shasta County.
Great. Thanks. So I just want to report out on the crisis intervention team CIT training that we held last week. We had 35 graduates. About a third of the class was from Eureka Police Department, another third from Yurok Tribe, including one officer, but the rest were like wellness court and social services staff. We had 2 board members, Raphael and Danette, participate in the full 40-hour course. We had our chair was nominated and won the Responder of the Year award. I like read what the nominator wrote about her, because I think it's super relevant to this work that she does here as well. So Laura's level of commitment to CIT appears to be inexhaustible. When Laura sees a problem, she goes after it, looking for solutions, putting in the work, and making things happen wherever she goes. Laura is always the first to be willing to help, get involved, and push for solutions. Laura's efforts in CIT and in all aspects of local mental health services are felt and deserve recognition. So I had to keep the nomination secret from the whole steering committee because I didn't want her to know. And I just, Laura was by my side through the whole training and supports so much with putting it on. And although I'm the lead facilitator and coordinator, it takes a lot of folks to put it on. And DHHS has been a big support with CIT as well. And so I'm excited to see kind of how it is. I feel like it was probably I always say this, I feel like it was our most successful training thus far. And I don't know, Raphael, if you want to contribute anything or.
Yeah, absolutely. I was really happy to report in my to my team that I think this training should be made available to everyone, no matter what your level of training. It certainly gave me a much higher respect for law enforcement. But I also learned a lot of things that I just, didn't know. And just hearing so many stories of, everyone's lived experiences too. But I think it was wonderful. I was very impressed. It was awesome. So thank you so much for putting that on.
Thank you. And I can't believe I forgot this one. This one was also by my side the entire week. And NAMI is a huge part of CIT. And I recently joined the NAMI board, which has been really cool because we've been working together on grants to get NAMI members to attend the CIT International Conference and to become trained as CIT coordinators. And so we're really looking at how we can continue expanding and succession planning. So it's not just one agency that's responsible for CIT moving forward. So I think all the years that DHHS kind of led CIT, it was too insular, right? And so I think we've done such a good job of branching it out and getting buy-in from all the partners that we're continuing to bring in new partners as well. So thank you to everybody that attended and supported, presented. And that's all.
Can I do communications real quick?
It's for the behavioral health.
Is it just the board doing communications?
We're just on a time crunch a little bit.
I just wanted to say I'll be on Cayman Radio, May 9th, 8 to 9, call-in show.
Thanks. Marguerite?
Yeah, this is, I think, a question for Paul and Amy and Connie more. I've been getting, through community contacts, I've had a lot of questions about what concerns specifically for our county we are with the trickle down of various things that are happening at the federal level. Things like big employment cuts in DHHS, the doing away of the Department of Education, those kind of things. And since I'm not directly working with the county right now, I don't know how to respond to those things. I even had a call from my pastor the other day saying, gee, I have people coming in to asking about services, et cetera. And the other one is Social Security. So I realize we're really in a big time of flux right now, and we probably don't know all the answers to that. But I was hoping that maybe at our future meetings, as things become clearer about that, that maybe during the county employees' parts of the report, they could really share that so that people won't be anxious about things they don't have to be anxious about. I do tell people that a lot of funding comes from state and local and, you know, like that too. But still, in our two behavioral health fields, SUD and mental health, a lot comes from up above. And a lot has to be processed from up above. So, you know, I'm just expressing my concern and letting you know that those questions are coming out to just ordinary community members who like know that I'm on the board and I don't quite know what to say.
We used to have a legislative update on the agenda. And I'm not sure if that would be a good thing to bring back. I don't know. So I'm gonna put that as a possible agenda item. Thanks. Bob, did you have any updates?
I do. On the May 17th of next month here, Nation's Finest is having a Game of Throws. I'll give this to Joe, just Joe to the flyer for you, but it's $60 per team at the event. And it's in the fairground. No, it's in Fortuna. At the Memorial Building with that. So if we're good at that, come and make the team proud.
Thanks.
I'm gonna save mine for the SPD committee update.
Okay.
All right, I've got some TAY updates. So in May, we'll be doing some events for May is Mental Health Matters Month. So every Wednesday at our drop-in center at 430 F Street, we will be doing t-shirt making. This is in preparation for the Mental Health Walk and Talk Center is putting on later this month. So you can check on the calendar that was brought to this meeting. Our lead peer coach, Jessica at the T Division will be having a mental health hike on Friday, May 30th for young people ages 16 to 26. So you can come and contact if anyone that you think is interested in signing up, they'll be going out to Trillium Falls and going for a mental health walk. I'll also shout out that that public health in collaboration with the Two-Spirit and LGBTQIA+ oversight body, they are putting on a Clearing Mental Health Youth Summit at Humboldt County Office of Education at the Sequoia Conference Center on Saturday, May 31st. Kelsey's a good person to contact for more information about that, but just wanted to shout that out as a learning opportunity for supporting mental health of trans, queer, Two-Spirit youth in our community. I also had a reflection. I'm not sure how to make this actionable yet, but just listening to the public comments from last meeting and this meeting, I've been reflecting on how the Behavioral Health Board in the past has done public hearings around county behavioral health services to get community feedback. I've been thinking about feedback about the treatment that someone received earlier that they mentioned at St. Joseph's. And so I've been sort of reflecting on whether thinking about this board as being an advisory body to the board supervisors, wondering if there's anything that we could do to sort of support that relationship building, support that feedback, getting back. And I'm trying to think about what we can do within sort of our role as advisory body and also sort of as our place within the county to maybe address some of those concerns. Because I would really love for people to be getting the kind of treatment they would like to get. So just putting that out there.
Thank you.
And I'll also add something else that some of our young people and myself and potentially some peer coaches are going to be participating in a training for lawyers and judges and some folks from probation in May. And that's going to be around how to better support Two-Spirit and LGBTQIA young people when they're representing them. So we're excited about them being able to share some information. Also, Queer Humboldt's going to be part of that training as well.
Awesome. Is there any board member online? I can see. I can only see the. Oh, okay. Yes, we will go on to DHHS Director reports.
Based on what Marguerite was saying, I think I'll talk a little bit about the budget. I'm doing a presentation for our budget for next year on May 5th to the Board of Supervisors. In that, we will be talking about the number of positions we've reduced and some of the services that have been reduced based on what our current state was, and then just preparing for other things that might come up. We don't have a lot of information about what's gonna happen in the budget, and we probably won't for a while. There's the state budget, the May revise comes out in May, about the first week in May. We'll hear a little on the May revise, but that doesn't take in, and the state is $60 billion short or something in the state. And then that doesn't take into consideration any cuts that come from the federal government, which could be between June and November. And if Nancy is still on here, I would just say, Nancy, if you have anything to add here, please do. We are watching everything that's happening, and to say that I don't have anxiety about it would be like, I would be not telling you the truth. I think that we are all in the same way, just trying to move forward with the good work that we do, knowing that there may be some rollbacks of some of the services or work that we do. We may have to do it differently. I can't even commit to what that might look like, because I just have no idea with all of the chaos going on, what's actually gonna stick, because it feels like they're like lobbying, there's a lot of lobbying going on, but whether it sticks or not is still really unclear. I do wanna say, you know, I think that, and some folks say, oh, it's all gonna be okay. I think that it's not all gonna be okay. But I think that some of us will figure out how to make it through and try to do the best we can in the work that we do to provide support to our community, because that's what we do here. And we're gonna continue to do that. But to say nothing's gonna happen or everything's gonna be all right, I can't say that, but I do know that we have a lot of experts in our field that will continue to try to support the community as much as we can. In addition to that, do you want me to say my update around Navigation Center?
No, that's later.
Okay.
Unless you're leaving.
Okay, and then I was gonna respond to somebody else's something. Oh, Kelly mentioned CIT, and I would just like to add to that, the undersheriff and the sheriff were at the Community Corrections Partnership meeting this last week and was asking about possible training dollars or some type of one-time dollars to pay for staff time to be at CIT, because they're struggling with budget issues also. So, I mean, I'm talking about salary time.
There's a whole
For-
mechanism for law enforcement agencies to,
Would you let
for
them
their
know?
salary.
Would you let them?
I don't, yeah, I'll
Absolutely.
connect them, or Jackie. you can connect
Okay.
them with Jackie.
That would be really great.
Yeah.
Because they were noting how difficult it is for them to be able to send folks. And the
We've
more,
always had that. Reimbursement for law enforcement that's why it's so important that it's post certified. Sorry, I am just, we had 2 county staff attend the training this year, 1 probation officer and 1 correctional deputy.
I think it's probably good to share that with them, and I'll just say that sometimes it's multi-layered when you send staff, like it's the salary and it's the time away from the direct service and
Yeah,
and
yeah,
it's
yeah.
covering, like there's multi-layers.
And the both of those
That's
departments usually send a lot of people for jail and probation, and they both communicated with me why. So it's just the fact that we rarely have anybody from the sheriff's office patrol. And that's a problem, considering they work collaboratively with behavioral health with NIST and they respond to crisis calls and
Yeah.
they say they're supportive of CIT and they don't send people to CIT.
We will continue to have those conversations. That's why I wanted to.
Thank you, yeah, appreciate it.
Okay, director of things. I was also gonna just flag the budget presentation and that continues to be an area of focus for us over time. And I'm glad for the questions around like federal funding and impacts. And I wanna just say, there's so many places of concern right now at like little places where we recently lost some of a block grant, like nothing substantial, but impactful to our community and our partners. And then, you know, we have MHSA transitioning to BHSA and the pretty substantial changes around prevention, early intervention. And Oliver and I were just talking this morning about how it's such an unknown still and the impacts that will have on current programming are for sure and just not clear. And so I want to keep saying that to this group because I know that it will have impact on our current programs and community. And so we'll need to, you know, ask for support and grace and ideas and leaning in to just like work together to pick up where we're having losses in the funding, because we do want to continue to do the work and how do we do it differently is what we're doing. Partnering. I'll just say, and Jack and Paul can add anything here that they want, but I feel like we're starting to have more audit reviews, scrutiny, and some of it I've already talked about, like we've talked about the audit around timeliness and access to services. We've had a recent EQRO review. We're having another one coming up. So just like, I don't know, I feel like we're getting kind of in a rhythm of audit, which is always challenging, especially when we're understaffed. And not only do staff need to participate, but then they need to produce things and follow up. And so anyway, I want to acknowledge that and appreciate the hard work that staff always do around those. And we always get compliments from reviewers on how well organized, how responsive, what a good job our staff do. So I'm just really grateful for that. And then the last thing I'll say is the May is Mental Health Month Matters stuff is happening. Yay, it makes me really happy. And I know there's lots of events. I get to be on the professional panel for the city of Eureka, which I'm excited and terrified about because I never like to do those things. But anyway, happy to participate and just really appreciate being invited again. So for me, it'll be good.
Who wants to go first? Jack or Paul?
I'll go real quick. We're excited that the Department of State Hospitals Diversion Grant is going for the board pretty soon, I think early May. The state hospital is granting us with some money to build out our diversion program as a permanent fixture, as well as the community-based restoration program. So we're excited about that. That's good news. We're also, things that are happening quietly that are kind of a big deal, but not a lot of folks know about, is we're having integration with our health information exchange, which is really great because, you know, if somebody goes into emergency room, say in Sacramento, we might not know about it, but you know, having an information exchange that will allow us to know about it so that the psychiatrist can follow up quickly with that individual when they get out of the hospital, things like that. So it really helps with coordination of care, but we're getting closer to integrating that into our electronic health records. So we're excited about those advances in technology and what that means to client care. So looking forward to having that in play.
Paul, can you expand just a little bit about the IST and what that really means for our incarcerated population and the amount of time that they've currently been spending in jail and what that is going to, how that's gonna change based on this grant, or we are hopeful that it will make a difference?
Yeah, that's a really great point. So right now, there's such a backlog for state hospital admissions from correctional facilities or anywhere, even in behavioral health, for instance, Semper Virens, if somebody needs a state hospitalization admission, we'll wait a year or longer. So the same thing is true for people incarcerated that are deemed incompetent to stand trial because of a felony they committed, you know, while they were in the midst of a mental health crisis, for instance. So they'll submit for that person to be admitted to the state hospital, but they'll wait in custody for a long time until there's an opening. So the state hospital has been really trying to work to reduce their the number of people they have, and they're really kind of pushing down into communities throughout the state to build programs like our jail-based, restoration program, but do it in the community. So diversion is an effort to help get folks treated in the least restricted environment as possible, as well as the community-based restoration program is that will be similar as treating them here locally instead of letting them languish in the correctional facility, waiting for an opening at the state hospital. So it's just really expanding the types of services available to folks that really need it, that are don't need to be sitting in jail waiting. They can actually be getting treatment. So we're excited about what that means there. We'll be able to treat about 25 people a year for diversion, and we'll have 8 beds for the community-based restoration a year for those folks. So we're really excited about what that means. And when we had our diversion program previously, we were easily filled up those numbers of 25 a year. So yeah, there's a need there for us, and we're definitely, it's another gap in our community that we have filled that previously we didn't have. So we're grateful for that.
Is it 25 and 8 per year or at any given time?
Well, at any given time, it goes through an 18-month period. So there's like kind of a little bit of a wiggle room there.
Yeah,
So that's
if, not every person will need to be in the program for a full.
Right. So then that's another
fill
slot that comes open. So
Okay.
they bump somebody in.
Got it. Thank you.
Acronym IST. What's that stand for?
Incompetent to stand trial, so if somebody due to a mental health issue. So if somebody just doesn't understand the consequences that they're facing or the impact that their actions had, they'll want to restore them, so treat them, get them stabilized, and then ask the question, so. But the diversion is if they stay engaged in treatment, the charges can be dropped. Yeah, and there's a housing element to these dollars as well. So we want to make sure that folks that are unhoused will work to get housing. We have a great housing program in the county, so we'll definitely working together in that effort.
Yay. That's good stuff.
Cool.
Yeah. That's what I always wanted when I managed that team, so I'm glad it's coming to fruition. Thank you. Jack?
Yeah, probably not a lot, just I had a chance to check in with the administrators with Willow Glen last week, just about Hyperion Lighthouse and how things are going there, a more formal meeting with with him, and we're just talking about some of the opportunities for improving things and what's going right, you know, so, but I think overall things are going really well. We were able to get somebody from the jail to step down into Hyperion, which was nice. That was kind of a link, and we've had a few folks that have come from out of county psych hospitals into Hyperion, so that's been a good link as well. That
Very cool. That's great.
we, you know, a lot of our folks have clients that have mostly come from Semper Virens, so we're still kind of working on somebody sort of floating out in the community going to Hyperion, and I think Paul and I are gonna have a larger meeting with them on that particular link, because that's a little more challenging for us. A lot of times folks, by the time we get everything together, will change their mind, you know, and it's voluntary program outpatient, so we need to do it more quickly. Is I think the answer, so we'll sort through that. In things, you know, at Lighthouse, I'm just gonna say, you know, no news there, which, you know, generally is the best, right, you know, news. So, you know, as far as I know, and as I'm told, things are going well, and I walk my dogs around there every day, and so all's quiet on the cut in front.
Good. Wonder if people complaining or not.
Yeah, that's right. All right. Moving on, SUD committee update.
SUD committee update. So I wasn't at the last SUD meeting, but Danette did say, she sent me what happened. Melissa did give a presentation, an update on Beaches Treatment Center. Also Humboldt Bay Fire reached out to the committee. So Melissa did an MAT presentation with them, and I'm going to be meeting with them tomorrow to talk about EMS bridge services. And that's a model that has been very successful in the Bay Area, where they start MAT even effort in the ambulance. So you know, California Bridge already has that model, so I'm going to present that to them and answer any of their questions they have about California Bridge in St. Joe's. So our what was it was already mentioned before that there's been a spike in trans folks seeking out services. We are seeing trans SUD rates go up, as well as the Latino SUD rates going up. We absolutely need more detox services, more withdrawal management services. Last week, I sent 13 patients out of the area to withdrawal. You know, that's not ideal. It's not sustainable. It's very, very, very uncomfortable for the patient. It can be very risky, especially if they're alcohol. So we have to, you know, the doctor, we have to just make sure that they are medicated. But you know, going 12 hours to, you know, it's just not sustainable. So, you know, as Dana mentioned, you know, there is, we are working on moving forward with the detox project here. And Dana has been working with the planning commission. So we're very thankful for that. And I guess, you know, we're gonna find out more about that, hopefully soon. And I think that's it as far as we also are seeing an uptake in folks coming in, younger folks who are using kratom and nitrous oxide, and they're getting these from smoke shops, and it's kind of unregulated. So we're going to be meeting with Dr. Candy Stockton to discuss it and just, you know, see what we can do. I am in communication with some parents that are very angry, that are, you know, want answers, you know, and I agree with them. You know, these kratom mimics opioids, and thankfully Suboxone it works, you know, but it should not be so readily available, especially to our young folks. I think that's it. Do you have anything that you want to add?
Well, I can talk about what we did at our last month's meeting because you weren't there and Danette's not here, but we were supposed to do 3 things, but we did one. The one we did was we heard from Aegis a report on the work that they do. And I think one thing that really struck me was that they talked about the percentage of the kind of opioids people are using now in comparison to the past. And heroin is like really, really low, and fentanyl is really, really high. As in over 80% of the people that they now see at the MAP clinics like Aegis. So we all had the opportunity to hear that presentation and to ask a lot of questions. So the other two things that we were going to do will have to be deferred to May. They are, Raphael had brought up that through email that it seemed like what we were doing was a lot like what the providers meetings were doing. So we were gonna have a discussion of, okay, what will our SUD committee of the board want to take on or do besides just having people come and make presentations about their programs, because, you know, that it's a kind of widely known by a lot of the people on the committee, because so many of the people on the committee now are not me kind of people, but they're like Raphael kind of people who work in the field. So we're gonna do that. And then also the SOHUM program was going to report last month, but they said that they would, since the Aegis presentation took the whole time, they will present this coming month. And so we're looking forward to hearing what, you know, what's happening more in the southern part of our county in terms of SUD services.
I just want to add one thing too, the OD rates are down. We used to be seeing 20 to 25 accidental overdoses a month. Last month was 13, the month before that was 11, so they're going down, the reported ones that are coming into.
So where does that statistic come from?
It's coming from our emergency department, so folks that come in for accidental overdose, yeah. I have 20 to 25, and last month it was 13.
Be interesting to compare people who don't come in.
Yeah, exactly. I wish we could capture that. I would love to capture that number. There's a lot of data that we need. Also too, I just wanted to put out there, Kirsten and I are navigators in the emergency department, but we also work for the entire hospital. And if anybody has an experience, you know, horrible experience at the hospital, please reach out to us. We'll walk them through how to file a grievance and how to do a DATIX report. We have to know how we can do better. And I just let all the patients know that if they have a problem, you know, in the ED, please let me know. And the providers know that too. So, you know, yeah, we just want to do better. So.
Thanks.
Can I ask, Marguerite, you referenced that you're gonna get a report from the cell phone program next month. Can I ask what program that is?
We can't hear you too well.
Oh, sorry.
Oh, I'm sorry.
Um,
You have to talk really loud. My ears have been plugged up for a couple of days and I'm going to the doctor, but I've heard about 1/3 of this meeting.
so you mentioned that the committee would get a report from the SOHUM program. Which specific program is that?
Remember the
So
name of the program?
Southern Humboldt Health.
Yeah, right.
Okay, thank you.
All right. Committees, we don't have any other committees at this time. Still need somebody to take on the children and families and the older people committees, which are in our bylaws, which we need to fulfill. Just putting that out there. Next is chairman and vice chair. And I will just say CIT was awesome. Everyone should go through that. And something else. And I can't remember. So we will go on to unfinished business. Navigation Center.
Okay, good. I think last time I said I didn't have any good information to share. This time I can share that I sent a certified letter to Justin Zabel, letting him know that he may be in breach of contract for not starting his process at this point, and he did contact me. And he has assured me that they will have a design very soon and prior to the 30 days that he was given. And so I'm still hopeful. I just have to keep being hopeful that we will have a navigation center at some point. As soon as I get design, we will start having community meetings about programming and what that actually looks like for us there. Because I really do want, and it's gonna work best if we have all folks that do this work and do a lot of the work down there as a part of the conversation, and so we're all on board. He says it won't take him that long to build the building because they're gonna do it themselves. They have a big organization. And so we'll see how that goes.
So is it, I just pulled out that old drawing
Yeah.
we got? Is that still what we think?
So he was going to try to make it 5 stories.
Right.
And that would put him completely out of any of the lease that we currently have with them. We would have to do an amendment and fix the exhibits and do all of that stuff. It took more than a year for our county to do the lease with them the last time. If we had to do that again, I would have to say, no, we can't do the navigation center because I'm running out of time to get this stuff. We are all running out of time. I think that we can say at this point because the need is so large.
Waiting to hear back.
So we're waiting to hear back from him, and I would also just like to say that our partnerships with the city has been extremely helpful, and I do feel like if we aren't able to go forward with that location, that we will be able to work with the city to figure out something different. And we recently had a really good meeting between the county staff and city staff around services that are being provided here locally, and yeah, I'm just hopeful. And during this time, and especially around the budget stuff, it's just so important that we have the collaboration and partnerships that we have today. It is extremely important for our community. So I appreciate every part. Couldn't do it without.
Teams, Mark, yay, yeah, right. Thank you for that. That's helpful. Care Court, I don't know, is there anything on Care Court? Yeah, pulse.
Is Pauline? You know, what I would like to say about Care Court is, I think that Care Court is having our system look a little different at ISP and all the other things in our diversion and all those things. We have Heather Cooper is our county counsel for mental health. That's just like the best. And so she's so good at LPS, conservatorship, and all of the processes that touches the jail. She's just so good at it. So she's really, we had more numbers in Care Court to start out with because they were coming from her, not actually from the community, which I was like, whoa, what's going on here? But really, she is actually helping the folks that have been stuck, that we feel like have been stuck in the jail and other areas and it may reduce the number of folks that have to be on conservatorship because we're touching them sooner than later. I'm hopeful.
Do you have a comment or?
I comment.
But I know we're almost out of time, but just anecdotally, there is a Euro tribal member who was the first care court referral. And I'm getting the updates through care court, and it sounds like things are on track. I don't work directly with this person, so I don't know for sure, but it seems like it's working. And then also, just to speak to what you were saying, I've worked with Heather on a few other folks that were stuck in jail, and we had a really interesting experience with a specific person who was found incompetent to stand trial, but we were able to get her conserved instead of going through that process, because we knew that that's what the person needed. And we're able to get her placed in a facility, and she voluntarily went, and it was exactly what she needed, and was really grateful for the support. And she'd been in and out of jail. EPD had been picking her up over and over. So working with Heather, and I just wanted to like piggyback that, yes, what you said is true, like we're finding how to connect the dots better for justice involved folks.
Yeah,
Really good. Mental health disorder, so, yeah.
good work. Are there any future items for the agenda? I think I got, couple things, maybe putting legislative back on. We have MHSA, or I'll never not call it MHSA. BHSA, yeah, I'll get it. MBHSA.
Totally agree with that.
The next time, if there's anything that you think of, send me an email, and other one is, with that, I will say, at 14:09, we are adjourned. Thank you, everyone. Thank you.
Thank you.
Thank you.
Not just around care court, but just the whole. I see folks there.
Oh, yeah, she's great.
She's really taking.
Oh, she's awesome, yeah.
She's really-
Even though I don't work for the county anymore, she's still.
We need awesome people. And I did note how much all of a sudden we had very good referrals, and I'm like.
It's a good point, I am. But, we're in that production.
Yeah. It's going good. It's good. Yeah.
Yeah, so that was.
And to know that, it's not all in our control, it's a whole nother thing, because I kept thinking that we had to do it all, and it's really not like that at all,
No.
right?
Right. It's,
And-
truly-
And the court can do whatever they want.
In some ways, it's a
do.
good thing that they're kind of having to really, pay attention to us and like work with us and collaborate. So in that way, it's been really good. Because now they're like, oh, man, we can do this. We gotta pull them in on this. So
Yeah,
it's been good.
that's good. Yeah, everyone can talk to each other, right? Know what's going on, yeah. So another court stuff that was really interesting. With law enforcement officers. And then putting them to know, we don't. You don't report to the you report to this over here, and this is all we're doing. I'm like, oh. So how do we know the county really? Because there's people in different places in the process. Like, they get all this. Some of them come down. But not all. A bunch of them are denied before we see because
Thank you.
of
I really
inaccuracy
appreciate
or
you.
the.
Well, sometimes
So if they don't have all of the documents.
where it needs to go, and y'all may already have the information,